Hi, my name is Allison Lewis and I'll be your dental hygienist today. So for your first visit, we'll be talking about toothbrushing and the proper methods to do so. So the plaque that you can sometimes feel on your teeth at times is very important to take notice of. This is from bacteria building up on your teeth. And our mouths go through a lot throughout the day, so it's important that we make sure we're taking great care of our entire mouth to prevent any farther damage. So the mechanical removal will assist any coffee stains or the tartar on your teeth with proper use of toothbrushing. This is also the most effective way to stay healthy and for your gums to stay healthy. The building up of tartar in your teeth takes only about 30 to 90 minutes to begin forming. So once the tartar is present, it creates a great area for bacteria to live and stick on, especially in areas that are hard to get to, like underneath of your gums. So if you exclude brushing your teeth from your daily routine, this can result in a number of diseases such as cavities, gingivitis, or periodontitis. So there are a handful of different brushing techniques that are used for different purposes, but the most commonly recommended method is called the BAST method. I'm going to demonstrate that to you today and how to properly perform this toothbrushing technique, which will help with keeping healthy gums and teeth. So before you start brushing, it is very important to know the importance of having a sequence while you brush. Therefore, you won't miss any areas in your teeth either. So after you wet your brush, you want to place down about a ½ inch of toothpaste on the bristles. And you want to make sure that you're holding the brush in the proper manner called the palm grasp. So this is where you'll have your hand around the toothbrush like so, and then you'll also keep your thumb right where like the indent is on most toothbrushes, and your back of your hand setting on the back of the shank, which is the long part of the teeth. Next, you will then want to hold the toothbrush in that palm grasp against the teeth. Doesn't matter which tooth you start on as long as you go out of sequence, starting with the most farthest back tooth. So you want to place the bristles against the teeth with a 45-degree angle going towards the gum line, doing 2 to 3 teeth at a time with a vibratory motion, doing 9 to 10 strokes of these. Then as you move along, you want to overlap the tooth that you were just on and doing another group of 2 to 3 teeth, 9 to 10 times. And then coming up here, keeping the 45-degree angle and 2 to 3 teeth. And trying to make like the bristles go into the pockets of your gum line. And moving on here. And overlapping. And over here, keeping the sequence so you're not skipping any teeth. And lastly, here. Okay, and then you can begin doing the insides of your teeth as well. So, over here, keeping a 45-degree angle and doing 9 to 10 vibratory motions against the teeth. Overlapping on the teeth that you were just on too. And then the only difference is once you get into these front teeth, you want to hold the toothbrush at a vertical motion, so then you're getting into the gum line here. Still doing 9 to 10 vibratory motions on each tooth. And then as you move on to the inside of these teeth, you want to also do the same thing again at a 45-degree angle. And there. Then you can move on to your top teeth, but this time with the bristles upward towards the gum line, keeping the 45-degree angle and doing 9 to 10 vibratory strokes. And up here. Still overlapping. And there. And the same thing with this one. And then you'll be doing the insides of the teeth too, keeping the 45-degree angle against the gum line, because this is where the bacteria thrive in. And then the same thing that you did on the bottom teeth here for the insides, you want to hold the toothbrush at a vertical direction, doing the same 9 to 10 vibratory motions. And then as you're getting back to the teeth back here again, you can keep the 45-degree angle. And overlapping. Then you also don't want to forget the pits and fissures on your back teeth here, so you can use a more firmer grasp, making sure to get all the food particles and bacteria out of these teeth, still doing a 9 to 10 vibratory motion on these and overlapping as well. And on the other side, and on the top teeth too. And lastly, here. So now that you know the proper technique of brushing, it's also important to make sure that you're taking proper care of your toothbrush. So it is recommended to have 2 different toothbrushes, therefore you can make sure that the one is dried before you use it again. On a regular basis though, you do want to change your toothbrush every 2 to 3 months, which is also about like the seasons, if that makes it better to remember. Or you want to make sure you do it before the filaments here become frayed or displaced. So if you are sick though, however, you want to make sure you change it right away, because the bacteria from you being sick will still be on the toothbrush, and using that over again could make you be sick with that bacteria surrounding your oral cavity. And after every time you're finished brushing, you want to rinse your brush under the sink with the tap water, and then you can tap it against the side of the sink, making sure that all the extra water, the excess water just drops off of it. And while you're letting it dry, set up wherever you do, you want to make sure that is in the open air in an upright position, making sure that it's about 6 feet away from a toilet and away from other toothbrushes. And you also want to make sure that you do not store it in closed containers where they're kept in a dark space or like a cool environment like that. So you're going to want to brush your teeth about 2 times a day. You could do this right when you wake up in the mornings and right before you go to bed as well. And the toothpaste that I would recommend for you would be a toothpaste brand, Crest. It's also tartar control toothpaste, and it's fresh mint flavored as well. This will help with the tartar on the lower of your teeth and your front lower teeth here, and on the insides of them as well, to prevent from the tartar building up in that area especially. So now we're going to move on to the tongue and the importance of it. So it is very important to clean your tongue, because the top side of your tongue contains these little filaments that bacteria can get trapped inside of those. So due to all the little projections there, it gives a great area for the bacterial growth. So not brushing it can also lead to bad breath as well, and a discoloring of your tongue, being like a whitish or brown color. So now I'm going to demonstrate to you how to properly brush your tongue. I'm going to do that by showing you on my hand as if it were a tongue here. So you want to first make sure you're holding your toothbrush at a right angle at the midline of the tongue, which is the middle here. And you want the brush tips to face towards the throat. And you're going to have your tongue extruded from your mouth as well, getting the sides of the filaments placed on the back of the tongue, and brushing outwards with light pressure and drawing the brush forward. And you want to do this repeating 3 to 4 times, making sure you're going over the tip of the tongue as well. This is the bottom of the tongue. So you want to keep doing that 3 or 4 times all over the surface.